Good afternoon, everybody. Thanks for joining us for today's webinar, The Science of Oral Health and How Bad Breath Could Tell You Something About Your Overall Health. I'm Greg Berry, Director of Communications in the Office of Alumni Affairs. Since we're virtual, please excuse issues that may pop up. You just never know. If you experience any video or audio issues, click Reconnect on your screen to get back to the webinar right away. So as we begin, I'd like to ask a question of our audience. How often do you brush your teeth? Once a day, twice a day, more than twice a day, occasionally, or rarely? We're going to leave this question up for a few moments for you to submit your response. A heads up to our live audience, this webinar is being recorded, and once it's uploaded onto our website, attendees will get an email with the replay link. Today, we're pleased to welcome Dr. Nico Geurs, Dean of the School of Dentistry, to our webinar series. Dr. Geurs is the first holder of the Weatherford Palcanis Endowed Professorship in Dentistry and second holder of the Dental Alumni Joseph F. Volker Chair of Clinical Dentistry. Before turning things over to Dr. Geurs, I want to go ahead and take a look at this poll. The results are twice a day. 73% of our audience brushes twice a day, 15% once a day, 2% says occasionally. So we'll get into that here in a little bit. So as a follow-up question, what are your biggest challenges in maintaining oral hygiene, or your biggest challenge? Let's select one of those. Finding time to brush and floss regularly, remembering to replace your toothbrush, having sensitive teeth or gums maybe, or understanding the best oral care products to use, or lastly, visiting the dentist regularly. I'm going to go ahead and leave this poll up a bit as I turn things over officially to Dr. Geurs. Thank you so much for carving out time and being with us today.
Well, thank you, Greg, and thank you, audience, for the opportunity to speak about oral health. Of course, this is something that's very important for me, but I also want to make sure it's very important for you. So I was asked to speak about bad breath, and that's a bit of a sensitive topic in that this is not something people like to talk about, and that includes me. But I will take this opportunity and turn this around into a discussion about what is important about bad breath, other than that you may not be able to keep friends and it could interfere with your social life. So bad breath actually is quite democratic. It is something that can affect everyone of us at different time points. And that can happen after we eat pungent foods like garlic, onions, or other strong foods. But it really gets to become a concern if that bad breath doesn't go away. By the way, the medical term for bad breath is halitosis. And sometimes I will use that term or I'll use bad breath. So if the bad breath does not go away, it could actually indicate an underlying issue that needs to be diagnosed. It's a warning message from your body, and finding that root cause is the first step in treating this issue. It's also important to realize that halitosis actually has a social and emotional burden in that it leads to embarrassment, potentially lack of self-confidence, and often sometimes strained social relationships. So understanding those causes is very important. And the majority of halitosis is caused by bacteria in the mouth, but other factors can be involved. And the good thing is that halitosis can often be treated by yourself. People aren't always aware of their halitosis, so sometimes it is important to seek that care. And where could you get care about halitosis? I would recommend that your dental professionals, your dentist, your dental hygienist are your first resource. So before we get into the oral cavity, I do want to talk about some of the systemic reasons for bad breath. And they are, to me, quite interesting because they can give us an opportunity to screen for diseases that you may not think you have or you may not have known you have. And this may actually be a pathway to treatment for these serious conditions, and it could facilitate the diagnosis of these diseases. So heartburn is one of those, and heartburn tends to lead to a little bit of a sour smell. SIBO, or small intestine bacterial overgrowth, really smells kind of bad, and it smells almost like feces. Diabetes we can pick up by a fruity smell on the breath, and if you have kidney issues, that smell could actually be ammonia-like or very similar to urine. If you have lung disease and bacteria that are hanging out in the airways and tonsils, that one is a little harder to distinguish from bad breath that is caused by bacteria in the mouth. And if you have liver disease, you may have a very musty, sweet to rotten smell. And those all are important to distinguish. The treatment for those are, of course, not provided by a dentist. But certainly the diagnosis or the screening for these diseases could be facilitated by a good discussion. And again, your oral health care provider may give you some opportunities to do so. So other reasons for bad breath, maybe food that is trapped in between your teeth or your tongue. And if that food is left there, it will get digested, and it potentially even gets, it will rot in your mouth, and it of course can contribute to the bad breath. Particularly strong foods like garlic, onions, coffee, meats, cheeses, spices, sugary drinks, all can contribute to bad breath. Now, garlic does it in a little bit of a different way, because this gets systemically taken up into your system and is then excreted back out as a gas in your lungs, and that's how we smell it. So it's very hard to cover up garlic breath with anything in the mouth. So now we start to enter into the mouth, and I have to apologize that from this slide on, there are going to be some teeth on the slides, and those teeth may not always look pleasant. So if you're eating lunch, it may be a little bit challenging, although I think we can get over this. So dry mouth is another reason for bad breath, and that dry mouth can be caused by alcohol, stress, or different medications or different medical conditions that you may be exposed to. And it's very important, again, to understand the reason for the dry mouth. And that dry mouth tends to contribute to an environment in which bacteria can thrive in a different way. Smoking and vaping are also associated with bad breath, and they're very interesting because smoking and vaping basically starve out the mouth from oxygen, and in that low oxygen environment, again, bacteria can thrive. And we've long believed that smoking was the bad one and vaping is kind of the transition. We're gathering more and more information that actually may lead to us thinking that vaping may be worse than smoking for your overall health and certainly for your oral health. That's not a topic I'm addressing today, but it's something to certainly take in consideration. Okay, so let's go in the mouth, because most of the bad breath that we're talking about that can be treated by yourself are from bacteria from the oral cavity. And those bacteria thrive in the oral cavity. They thrive in the different areas in your mouth and are mostly bacteria left on the teeth, in crevices on the teeth, or in cavities on the teeth. If you develop gum disease, the amount of space that is available for these bacteria to hide increases, and the number of bacteria can definitely increase. And now the challenge becomes taking all these bacteria out on a day-to-day basis. So what bacteria in your mouth may actually be telling you is that there is a disease in your mouth, and that could be the case. In many of the pictures you see here, a disease that needs to be treated, not just for the bad breath, but also to keep your teeth. And later in the presentation, I will talk about how it's also important to have an oral cavity that is free of disease for your overall health. So what I want to do is take you through a little video clip that shows you what bacteria actually do in the mouth and how they organize themselves. And this little video clip will start from the time point you put your toothbrush down in the bathroom and start walking to your next task. So imagine what all can happen in your mouth. So bacteria, once you brush your teeth, are somewhat reduced, but we don't take all of them out. So the leftover bacteria, the ones that have been able to avoid being brushed away and swished away, will start to accumulate again, and they will do so on all surfaces. They'll do it on the back of your tongue, they'll do it on your cheeks, on the mucosa, on your gum tissue. But the best place for them to actually accumulate is the tooth surface. And why is that tooth surface so important? And by the way, what you see here is the amount of growth of these bacterial colonies that will occur in a relatively short time period. So if you didn't brush since breakfast, this is about where you are. So that tooth surface allows for those bacteria to kind of stick to that surface and not go away, whereas the other soft tissue surfaces are a little bit more slick. They're not hard, they change. And that tooth surface now becomes a great place for them not only to stick to, but to organize themselves into different groups of bacteria. And those groups of bacteria, as they mature up, now start to affect the soft tissue. And that soft tissue now has to respond and becomes inflamed. That's where we're going to move on to the next slide, because in that whole story, I talked about the tooth surface being a great place for bacteria to stick to. And that is true. But I want to look at the overall oral cavity. It's basically a perfect environment, almost like the Garden of Eden for bacteria. Imagine, it's nice and moist. The temperature is perfect for growth. There's a pH that allows growth. The carbon dioxide tension is great. And there's an abundance of nutrients. In essence, when we eat, we feed our bacteria. So there's an abundance of nutrients, and particularly on that tooth surface where bacteria can stick to so well that we can't wash them away with a simple spray. We have to actually mechanically scrub them off with a toothbrush, with floss. They can stick around for a longer period of time. And in a patient like this patient over here that's nice and healthy, those bacteria have been removed every day, maybe a couple of times a day, like you brush and floss your teeth, remove that biofilm, nothing really happens. But if we allow these bacteria to continue to sit on the tooth surface, your body is going to say, well, hold on, what is happening here? I am being challenged by these bacteria, and the gum tissue must respond. Because in a way, the junction between the soft tissue, the gums that wrap around your tooth, and the tooth is a very odd connection on the outside of the body. There's nowhere else where hard tissue sticks through soft tissue. And it kind of represents the weakest link on the outside of the body. So your body responds to that by becoming inflamed. Your gums will get inflamed if you leave plaque on your teeth. And that now leads to a different type of environment. So let's look a little bit more at these bacteria. So the bacteria that are accumulating around your teeth or in your mouth or on the back of your tongue are really producing many products, and those products are contributing to the bad breath. Volatile sulfur compounds are the most common ones, but we can have hydrogen sulfate, methyl mercaptan, dimethyl sulfite, all can give you a addition to the bad breath. And there's nice ways to describe that, like rotten cabbage, gasoline, etc. Now, what is this telling you about your mouth? The bad breath tells you that bacteria are in your mouth. And the more depth to that bad breath, the greater the impact of those bacteria could be on your overall health or on a patient with gum disease. I'm going to now show you some slides that may not be great to look at, but If you have plaque accumulate on your teeth, like in this patient, and this patient happened to also be a type 2 diabetic, but this patient has many issues here of plaque that now not only has accumulated, but it has hardened up on the teeth. That's another thing that happens with it will harden up into calculus or tartar. And that tartar now will not be scrubbed away by you. It will be there, and it's a nice porous surface, and it will always have bacteria on there. So as long as you have that there, you will have bacteria. It now becomes the plaque that you cannot brush away anymore. And as long as that's there, your body will also respond to that. Your gums will be fiery red, inflamed, and may very well bleed quite easily. So this is something that now will be a perpetual source of bacteria in your mouth and will perpetuate bad breath. So if you have a lot of calculus in your mouth, it will be a constant contributor to your bad breath. So if we go back to this patient here, we looked at that in a smaller format, but I want to kind of look at this little gum area in between these teeth. And if you look on the tooth, you can see this plaque sitting there. That sits there at the most obvious spot for bacteria to kind of hide from brushing, and that is in between your teeth. It's also the place where we see most plaque left and where most of the disease that we see in the oral cavity is initiated. Cavities are most common found right in between your teeth, and gum disease affects the area in between your teeth. So earlier we talked about the importance of brushing and doing that every day, but flossing is really what gets to your spaces in between your teeth. And if you've actually lost some space in between your teeth and you've already lost some support, other tools may be important too, like interdental brushes or a toothpick. But flossing is important, and flossing is not something people often want to do. And I would encourage you, if you do not floss, find some old floss you have and take that floss out and floss in between your teeth. And then smell that floss. That is maybe not something you want to talk about over lunch, but as you smell that floss, you may find the source of some of the bad bacteria in your mouth, and you may find that they don't smell very pleasant. So cleaning in between your teeth is a must if you want to have good oral health, but it's also a must if you want to prevent bad breath from affecting you, your friends, and family. So ultimately, we'd like to have nice, healthy pink gums. This is a patient that has taken good care of their teeth and their gums, and they're all happy and smiling. But as the bacteria start to accumulate on your teeth, your gums may respond, and they may very well become more red and puffy. And that redness and puffiness you may be able to see. And other things you may notice is that your gums may bleed when you brush them. That never is a normal sign. That's a sign of disease, and that is a sign of something that needs to be treated. Now, in the initial phases of gum disease, you will have a disease called gingivitis. This is inflammation of your gums, and again, characterized by this bleeding. Your dentist or your dental hygienist may check for that when they examine you, and they may use this little periodontal probe around your teeth, and you may think they're poking you. And to be honest with you, healthy gingiva would never bleed if you were to manipulate it with one of these probes. So the fact that they bleed is not the dentist, but it's your tissue that can't withstand the normal forces of that probe, and therefore it's the inflammation that leads to the bleeding and not the poking of the dentist. Now, this disease is very nice because it is a curable disease. It is merely inflammation of your gums and no bone has been lost. So you haven't had irreversible damage to your surrounding tissues around your tooth. So that is an important phase to take this alarming signal of first the bad breath and then potentially the bleeding of your gums and start doing something about that. In gingivitis, it merely is coming up with a strategy to keep bacteria from being on your tooth surface. And that you can do by yourself, but often to get there, you need the help of a dentist or a dental hygienist. It gets a little bit more challenging if we leave that plaque on the teeth in a susceptible patient. And I'll come back to that in a little bit, because only about half of the adult population gets permanent destruction from gum disease. And that's now a disease that we start to call periodontitis. So first, gingivitis, inflammation of your gums alone, no permanent damage, curable. But the progression of that leads to permanent destruction, and that permanent destruction is characterized by losing supporting bone of your tooth. And that becomes something that is very difficult to reverse, and something that you for sure will need help from your dental hygienist and your dentist, or maybe a periodontist like I am can help you with that. So this is kind of a diagram that shows you a tooth with nice support, but with starting inflammation, with a tooth that has continued inflammation and bone that has been resorbed away as a result of the inflammation that was present. And you can see this progressing to the point to where tooth loss is in play. So having this treated in the very early stages when you have bleeding gums and you first notice that is the easiest way to prevent tooth loss, because you can imagine once you have lost this much support, it becomes harder to get back to a situation where you can keep that tooth. So I'm going to show you a little video clip that I think is quite interesting. And this is of a campaign to make people aware of their gum disease. So yes, it's true that tooth loss can be the final stage of periodontitis, the gum disease that has that permanent destruction. But some of the intermediate phases and the intermediate signs and symptoms are not just bleeding gums, but it could be teeth that have shifted or gum recession, particularly if it's gum recession that's all around your teeth. This was a patient that actually had all their teeth nicely lined up at some point, but because of the loss of support around this tooth actually started moving a little bit. It didn't have that solid grip of that socket that would able to hold it in place even if we chew and bite on things. It now started wandering away. So getting spaces to occur, getting gum recession that is around your full tooth and not just on one surface alone could be another sign and symptom. So we talk about half the population over 30 has gum disease that has led to permanent destruction or periodontitis. Now, if you look at this slide, you may think that most of those people live in the South. That's not really what this diagram is supposed to show. It's supposed to show that not everybody is susceptible to this disease. And that is an unfair thing. Some people have a lower tolerance to having plaque on their teeth than others. Some can have a lot of plaque on their teeth and never really get to the point of getting permanent damage from that. They will all get inflammation and they will all get bad breath if these bacteria stick around longer, but they may not all get periodontitis. You can also imagine that if you have these deeper pouches or pockets, like in this patient with a lot of gum disease, that there is more places for bacteria to hide. They kind of hide in those spaces underneath the gums that you can't, as a patient, really clean. And the bacteria that live in this environment smell differently, and they produce more bad breath causing products. So it's very important to understand that this disease has to be treated, and it requires often a deep cleaning. Now, if you are just dealing with your gums, it is very important that you come up with an oral hygiene routine that is something that you can do on a daily basis. It's something that you make a routine that you cannot live without, because that's the best way to keep plaque of your teeth. And that's the best way to treat disease if it were to occur. Because here's a patient that had a lot of inflammation around their teeth. And the reason for this inflammation was the plaque on their teeth, and simply working with their dentist and their dental hygienist, getting the right regimen and changing behaviors got them to nice, healthy gums. And this has effects on the gums itself. It has effects on your breath. And it also takes the bacterial load from the mouth and the bacterial burden that may affect your overall health away. And it takes the burden of the inflammation caused by these bacteria on your teeth that potentially could happen systemically also away. So brushing, flossing, mechanical treatment of bacteria is the mainstay in how we keep bacteria off. Now, you may say, well, how about mouth rinses? That sounds like a great idea. I'm rinsing around with something and it does the work for me. Remember that to kill bacteria, and these mouth rinses aim to kill bacteria, they actually have to reach the bacteria. Most of the plaque that you have on your teeth sits below the gum line or right at the gum line and is rather thick and creamy. And without disrupting that first or kind of stirring up these bacteria, these mouth rinses do not really reach the bacteria you want to kill. And potentially the nice flavor of these agents is not going to cover up what these bacteria will be able to produce in bad breath causing products. So you can't mask bad breath by using a mouth rinse. The effect of a mouth rinse on bad breath is almost negligible, and the time frame it affects it is only a short time period. The other negative effect of a bacteria killing mouth rinse is that it easily reaches many of the good bacteria in your mouth. You may say, well, why are bacteria good? Remember that in our body, we have more bacteria than we have our own cells. And we kind of live in harmony with bacteria, and having bacteria in your mouth that are friendly to you allows them to fight off any bacteria that may want to be harmful to you. And it's harder to join an established community of bacteria that all thrive together as a new bacteria to cause disease. So it's part of your own defense. So rinsing with an antimicrobial mouth rinse may actually have negative health effects, has little effect on your overall oral health, and is not something I generally recommend. As an adjunct to good brushing, it has shown that you form plaque less fast, but I think you can overcome all of that by good brushing. Now, if you have periodontitis, advanced gum disease with permanent destruction, I told you that cleaning your teeth will require professional intervention. It will require removing all the bacterial deposits, the plaque and the calculus off your teeth, and that requires mechanical intervention. That is very important, and it should be one that your dentist and hygienist should take care of. And every time you come in, they screen you for this disease. This is often characterized by calling out a whole bunch of numbers, but at least they probe that space between your tooth and your gums to establish whether or not you have that signs and symptoms of periodontitis. The other thing that's very important is that if you smoke or vape, we can't really treat your gum disease. You're going to have to quit. And in Alabama, you can call the quit line. You can actually do this nationally, but you'll end up being connected with the Alabama Department of Public Health experts, and they can come up with an individualized strategy that may work for you. It's the easiest way for me to tell you now what to do if you are smoking and you're interested in quitting. And that goes for vaping as well. Vaping also has a textable number, and I don't have that here with me. But it is important to understand that if you do smoke or vape, it is very hard to improve your oral health. So now I'm going to end up with a couple of little slides about how bacteria and inflammation from your mouth can affect your overall health. Bacteria accumulate around your tooth, and they're there, and your body will have to respond with that inflammation. And as the process of inflammation is there for a longer period of time, not only the bacteria that are there potentially end up in the bloodstream, but also the inflammatory products. And this now creates both a bacterial burden from the mouth as well as an inflammatory burden from the mouth on the rest of your body. And I'm going to go back to that original video clip in which I'm going to take you through it rather quickly, because we've seen the bacteria grow, and they kind of grew right here on your teeth and led to the changes in those gum tissues. Those changes, the inflammation, really leads to the little capillaries becoming a little bit more brittle. And as they are more brittle, something as easy as eating an apple could disrupt these capillaries and now allow bacteria from the oral cavity to end up in the bloodstream. Not a large clump like this, but individual bacteria that can now affect other systems in your body. And we have quite a bit of evidence to support that the cardiovascular system is affected by chronic exposure to inflammation and bacteria from the mouth. Atherosclerosis is one. Pulmonary disease is another one. And rheumatoid arthritis, or potentially a prosthetic joint, are also affected by bacteria and inflammation from the mouth. And so is our pregnancy outcomes. So it's important to keep your mouth healthy and work on good oral hygiene. I will give you an example of how your mouth plays a role. For instance, if you have a joint replacement. A joint is an artificial surface, and many patients that get one of these joints placed may very well get the advice to take an antibiotic before you see the dentist. Well, that antibiotic you take before you see the dentist is really there to prevent bacteria from your mouth to seed on your joint replacement. In this case, there was a case that was published, and it was published in the British Medical Journal, but the lay press picked up on it because it talked about how a patient that started flossing actually caused this disease or these bacteria to shift around to the joint. And what they did is they kind of looked at what bacteria were on the prosthetic joint that got infected, and then started looking at where do they normally live. And they found out that this bad bacteria, Streptococcus gorondini, who predominantly lives in the oral cavity, had made his way to the joint. And they said, well, hold on. When we started talking to the patient, this patient started vigorously flossing and caused a bacteremia, or caused bleeding that allowed bacteria to get up into your bloodstream. And that was the reason. So it was the flossing that caused the problem. Of course, it wasn't the flossing. It was the fact that this patient had disease in their mouth. Because if you have nice, healthy gums, flossing does nothing for bacteremias, and you can easily remove them without causing damage to your gums. So good oral health is important. And if your gums look like this and you have a prosthetic joint, you're constantly at risk. Not just when you visit the dentist, but when you brush or floss. So having that periodontitis or having gum disease with its inflammation and bacteria affects the oral cavity. And we know that if you have a significant burden of gum disease in your mouth, you are twice as likely to have negative events occur in cardiovascular disease. We also know that if we treat your gum disease, the risk profile for future cardiovascular disease will be lower. We can mitigate that risk by optimizing your oral health. It will not prevent you from having a heart attack, but it changes your risk profile, mostly because significant markers that are associated with a higher risk for cardiovascular disease are lowered by better gum health. Another thing we can do in the oral cavity is look in the mouth and use that mouth as a mirror to the rest of the body. Here are two patients that did not know they were a diabetic, and just looking in their mouth makes your hygienist or your dentist say, hey, this is not normal plaque and inflammation disease. This is something that's odd, and we're going to have to screen you for these diseases. And that screening can be done in the dental office like we did here, where we actually found measurements of disease that associate this patient with undiagnosed diabetes. And that's the case for both patients here. Or it could be a referral to their physician to be helped. A dentist will never diagnose diabetes, but they can facilitate that. And if we then treat your gum disease, we also know that that impacts the treatment of diabetes. So keeping your mouth healthy or treating disease when you have something like diabetes makes it easier to treat that systemic disease. So ultimately, it is not just about keeping your breath healthy. It's not just about keeping your teeth. A healthy mouth is required to keep a healthy body. And so there are lots of reasons to see your dentist, your hygienist, to have a toothbrush that you use multiple times a day, and to clean in between your teeth. And of course, it also helps your smile. So that's what I had as my active presentation. I'm certainly happy to answer any questions you may have.
I did toss up a quick poll towards the end, Dr. Geurs. How long ago was your most recent visit to the dentist? 76% of our audience said within the last 6 months. 14% said within the last 6 to 12 months. 5% more than 2 years. So got some work to do with some places. So let's dig into these questions. Several regarding floss, and we're going to start with this one. Does it make a big difference if you floss twice a day, or is one floss per day in the morning or at night just good enough to go?
Okay, so for that, if you were to and don't take this as advice, but technically speaking, if you were to remove all your bacteria out of your mouth every other day, that's good enough. But none of them do that. None of us do that. That is preventing disease. So the more often you go after plaque, the more often you get a chance to remove these bacteria. And this is why we advise you to do it twice a day. If you pick to once a day, understand that this is somewhat of a compromise. The better time to do it would be in the evening, because at night, our defense mechanisms, saliva, etc., kind of shut down. So bacteria get more free rein to grow. So the most important time for cleaning your teeth is the evening. That is not advised to not brush your teeth in the morning or during the day. And then you may take this as a motivator. The most common reason you have to brush your teeth in the morning is to remove bacteria that have survived throughout the night and that are highly associated with bad breath. Morning breath is one of those signs and symptoms. So brushing in the morning may be more for brushing and flossing in the morning, may be more for keeping your friends and family. At night, more for preventing disease.
When it comes to sensitive teeth, is there an effective treatment or even a prevention for that?
So sensitive teeth occur because some of the tooth root is exposed, and that tooth root has tiny little canals, and it can communicate with the nerve inside of it. And we have treatments for that. The most simple and most effective way is to use fluoride. Stannous fluoride particularly has been associated with reducing that sensitivity, and that you can do at home. If that doesn't work, there are applications of fluoride that your dentist can do that are a little bit more thorough. You could consider covering up roots that are exposed and lead to that sensitivity by your periodontist with gum grafts. And ultimately, we can put a small layer of a filler material over those root surfaces to get rid of the sensitivity. But the first line should be a fluoride-containing toothpaste or an anti-sensitivity toothpaste.
Should you still try to floss your teeth if you feel that it's too tight, that you need more strength and it can cause bleeding if it hits the gum fast?
So the floss, and this is an important aspect of flossing, the flossing is not a up and down motion. So if your contacts between your teeth are really tight, the best way to get that floss in is to make a sewing motion, gently pulling this around the tooth. And that sewing motion back and forth is also what gets the plaque off, not the one time in and out, but the really kind of back and forth sewing motion as you pull this in and around the tooth. And it needs to be adapted to the tooth surface. I didn't have a lot of technique slides on there because I find it difficult to explain on a slide. And if you need those instructions, your hygienist can do a far better job with you individually. And they can even look at other ways you can clean your teeth.
What about water flossers? Are they useful in decreasing bacterial colonies and plaque development?
So water flossers are great for reducing bacterial load. They, however, are not really great at treating disease. And there's a couple of reasons for that. One, if you have disease, your bacteria may be hidden below the gum line, and a water flosser generally doesn't reach those areas. So I think a water flosser, the use for a water flosser is best in maintaining health. So you have healthy gums, you use a water flosser as an adjunct to your other oral hygiene, then it can be beneficial in maintaining health. But it doesn't really work to take somebody that may look like this back to health. It's actually in a case like this where you have a lot of inflammation, and you have to kind of remember that if you get this much inflammation, these puffy red gums, that using a water blaster on there can actually damage this tissue and lead to bleeding. And it now actually creates a better chance for bacteria to enter into the bloodstream. And it's not recommended to treat this with a water flosser. But if your teeth look like this, it could very well be a good adjunct. So maintaining health is what it can do.
Is there such a thing as brushing or flossing too often?
If done correctly, no. But what we commonly see in patients that they have the perception that hard brushing is better than gentle brushing. And I want to take this analogy. If you are cleaning off your sidewalk with a broom and you put a lot of pressure on that broom, it's not, the bristles are not going to go anywhere. You kind of have to lightly let those bristles dance over that surface. The same with your tooth. If you brush teeth, you need to have a gentle pressure on there, and that gentle pressure cannot damage your gums or your tooth surface, whereas hard brushing can, and it is more effective in removing the plaque. So let the bristles dance and almost have the toothbrush in your hand like you have a pencil. We often grip it like a baseball bat. If you pick it up like a pencil or a pen and brush your teeth, that may not be comfortable to do, but at least it can teach you the amount of pressure you need to be effective with the brushing. So more pressure is not more effective in getting plaque off and potentially detrimental to your teeth.
According to this viewer's dentist, their teeth and gums seem perfect, but they still suffer from bad breath.
Okay, so there are many other underlying issues. And one of the other underlying issues that I actually failed to mention is that the tongue itself can harbor a lot of bacteria. And one of the things to do about that is to have a tongue scraper in which you gently remove the bacteria that are accumulating on that tooth surface. But there are patients that have other reasons than the plaque and gums in your mouth. It could very well be the throat or the tonsils, etc. And in those scenarios, it's best to consult a physician on treatment for those diseases.
What role do dietary habits play in cavity prevention? And are there specific food or drinks that we should avoid to reduce the risk of cavities?
Well, cavities are the result of bacteria taking the food you eat and turning that into acid. And most of these bacteria love sugars. So sugar and bacteria on your teeth are a bad combination, particularly if you get to the point to where you have a drier mouth. And over time, as we age, we lose our ability to produce the same amount of saliva. So sugar and bacteria are bad, particularly in a dry mouth. And avoiding sugar in large quantities, particularly over a longer period of time. One of the worst scenarios for tooth decay is somebody that has a sugar-containing drink and sips on that over an extended period of time. In the South, sweet tea is an often used sugary drink, and that's not gulped up in a fast gulp, but basically bathes our bacteria into sugar, and sugar in your mouth will turn into acid. So exposure to sugar should be avoided.
My mom is a dementia patient. She had wonderful oral care habits prior to being diagnosed. We've tried to brush and use a water pick daily for her. She is bedbound now and are only able to use oral swabs. Her breath is terrible. Any suggestions?
Yeah, those are very, very challenging environments. One is that many of those patients that are in nursing home or in care facilities may not have access to a dentist, may have resistant behavior against brushing, and don't really like their mouth to be cleaned. And now we kind of have to accept the compromise of just swapping around in their mouth. In those cases, even though I do not think they are super effective, swapping with a very effective mouth rinse like chlorhexidine and killing bacteria may increase the effectiveness of that cleaning, but we'll have to accept that it's never perfect. It's very difficult to get all those bacteria out, and you have to kind of realize that as long as they're there, you can't get rid of the products those bacteria produce. So it's a difficult thing to treat, and it's a challenging population because they have resistance to participating in the oral hygiene. We've done some studies on ways to reduce that resistant behavior, and it tends to be almost more of a game to get them to cooperate. But that is a very challenging environment that unfortunately I have some personal experience with. My father, a very proud dentist, actually was in a nursing home and lost one of his front teeth and didn't really care about it, but also didn't really take care of his teeth anymore. And it became the caregivers that had to do so. And many of them are tied up doing other things and not having a focus on oral health.
Does it matter if you brush first or floss first?
That's an ultimate debate. I would say if you want to do something right, flossing is more important than brushing to prevent disease. So floss first. So I would recommend flossing first and then brushing.
Are electric toothbrushes better than traditional ones?
Electric toothbrushes make it easier to get the right results. So if you're struggling with brushing really well, an electric toothbrush could be for you. And then there's a couple of different options. You have the ones that kind of circulate around and back and forth. And those are great for people that can hold that toothbrush and put it on the tooth the right way. And you have the ones where the bristles just kind of go fast. Those are better for patients that can't have the dexterity to put it at the precise spot. But they can certainly be quite effective in removing the plaque. However, if you are a champ with a manual toothbrush, you can achieve the same results with more effort.
I like this one. Dental sticks or floss? What's better?
Depends on your teeth. If you have spaces between your teeth, the dental sticks, which I assume you call a toothpick, are more adapted to that larger space. If you have tight spaces, floss is better. And if you want to floss, it's better to use the thread that is loose versus the holders with the little floss in it, in that they tend to not adapt to the tooth surface. You kind of have to hug that tooth surface with the floss, whereas those little flossers tend to take it straight up and down.
Do you recommend to clean tongue surfaces to remove the whitish tissue every day?
Yes, and I think that's particularly important from a bad breath perspective. And you can simply use your brush, but there are also specific tongue brushes with it. And remember that the tongue is a delicate organ, so don't brush that too hard or scrape it too hard. So scrape it gently, and that is a important source of bacteria, and a particularly important source of bacteria for bad breath, for morning breath. So if you are to use a tongue scraper, the better time to use that is in the mornings.
When it comes to a cracked back molar, would the sensitivity and pain be felt on the tooth in front as well, specifically when chewing gum and it hits directly on the middle of the tooth?
This becomes quite a specific question, but I can imagine that if you have a cracked tooth, that nerve now is really tickled. And every time you challenge that by biting on something, that nerve fires off a lot of signals, and that may confuse the signals from the tooth in front of it. So you can get some referral of that pain to the tooth in front of it. It's not likely that that tooth is actually hurting, but you may perceive the pain of the bad tooth behind it also in the tooth in front of it.
What about alternative sugars? Are they just as bad? This person uses sugar-free flavor additives to their water jug. Is that just as bad as drinking sweet tea?
So if you use a sugarless sweetener, they are not as bad for tooth decay. As a matter of fact, they don't have an impact on tooth decay. So that's a way to change your diet. There's some classic studies that were done in Finland, in the city of Turku, in which they replaced all sugars with sugar alcohols that don't have an effect on your tooth decay, and they were able to demonstrate a significant reduction in tooth decay rates. So taking the sugar out and drinking a sugar-free drink is, or a sugar substitute from a tooth decay perspective, is better. There are some other health concerns with those that you need to sort out, and I'm not an expert in those.
This person uses wax floss dental tape. Is the wax harmful?
The wax is on the floss to make it go through the contacts a little easier. The only effect that the wax may have is that it forms a thin coat of wax on your tooth surface. So if you now did what I recommended earlier, floss first and then brush with the fluoride-containing toothpaste, it may have a harder time reaching that surface that just got a little bit of wax on it. If it's perfectly clean, that may not have an effect, but the wax is not associated with other health effects or other gum effects. But if you are a high-risk patient for tooth decay, you may not want to use the waxed floss, as it prevents the fluoride getting to the right spot sometimes.
Are there new tools out there? And this is going to be the last question for our audience, just so everybody knows. Thank you so much. It's been a very active chat. Are the new tools out there specifically for tonsil stones worth trying?
So the tonsil gets kind of out of our area. I don't really deal with tonsil stones as a dentist. I'm not familiar with the new tools, so I won't be able to answer that question.
Got it. How often do you go to the dentist? When was the last time you went, Dr. Geurs?
The last time I went was in October. You have to remember that I'm right around dentists. So for me, it sometimes is remarkably challenging because it's very easy to reschedule that appointment. I did get a reminder that from our system to schedule my next visit, and I am trying to also keep those appointments. So you should never reschedule your dentist because they're very busy and it's hard to get your appointment next time. Those are important visits for your teeth, your overall health, and your breath.
All right. Well, Dr. Geurs, thank you so much for answering all the questions, the great information in the presentation. It was great having you with us today.
Thank you for the invitation, and thank you, audience, for sitting through this important topic during your lunch.
You're incredibly welcome. And in a moment, I'm going to highlight a few of the upcoming webinars for you, including the next in the Science of series. But first, just a quick reminder that we plan to upload today's presentation onto our website. Once it's ready, attendees will get an email with the link. As promised, here's a look at some of those upcoming webinars. On Wednesday, February 5th, Dr. Alan Gorman will join us for Networking Without Borders, Building Your Network in a Remote World. Then on Wednesday, February 12th, come back for the Science of webinar as we welcome Dr. Christina Pierpiola Parker for the Science of Insomnia. On Thursday, February 27th, our partners from Mission Collaborative will join us for Designing Your Impactful Career. And on May 20th, Dr. Sophia Bees will present the Science of Sugar. How's that for irony a little bit? Sweet Secrets Uncovered. Register for these and more at alumni.uab.edu/events. As we close, we just want to know how we're doing and what you'd like to see in the future. The QR code on your screen takes you to a very short survey where you can share your thoughts with us. Once again, thanks so much for joining us. And as always, go Blazers.